So this is the plan of a patient who was having basal cell carcinoma at multiple sites. Those were the patient was having it in the right ear, involving the right ear. The patient was also having the basal cell carcinoma of the forehead on the right side and on the uh, left face as well below supraorbital area. So those the patient had first underwent surgery. So the margin for the basal cell carcinoma present in left infraorbital area was clear. So the patient so there was no indication for adjuvant radiation in that site. The patient had also basal cell carcinoma in the right forehead, so it was also PT1 tumor and the margins were clear. So the patient that was also clear. So the patient had only this the tumor present in the right ear. It was involving the cartilage, and a surgeon underwent surgery which was margin positive and involving the cartilage. It became the T3 tumor. So the margin positivity makes it as the indication for radiation therapy. So the patient will receive radiation therapy as per the protocol. We planned that the patient age is old and he was wheelchair bound, so we planned that he will receive 40 gray in 10 fraction. So the fractionation technique depends on this. So this is the usual fractionation. A patient can receive 60 gray in 30 fraction, or 55 gray in 25 fractions, or 50 gray in 20 fractions, or as just in our patient, the patient can receive 40 gray in 10 fraction with the rate of dose 4 gray per day. uh, for 2 weeks, 5 days a week radiation therapy. So this is the guideline from EVIQ. So the patient will receive 40 gray in 10 fractions in our patient. So this is the hypofractionation in the basal cell carcinoma, and this responds very well in our patient, this 40 gray in 10 fractions. But there is another ultra hypofractionation also, which are bed bound patients. So we can use the 30 gray in 6 fraction or 35 gray in 7 fraction with the 5 gray dose per 6 gray dose per fraction in 5 days. So this is also ultra hypofractionation in the basal cell carcinoma. So how we controlled it? We controlled first left parotid and the right. So this is the left parotid of the patient, then the right parotid gland, the eye lenses, the optic chiasm, the brainstem, cochlea, the eyes. So these were the organoids: the brainstem, parotids, the lenses, and all of them. So first, after making this brainstem, spinal cord, parotids, eyes, lenses, cochleas, optic nerve, and optic chiasm, then we mark the clinical target volume. First, after marking the clinical target volume and cropped it from the air and extending outside the body, then we give it a margin of, so this is the clinical target volume involving the right ear, the surgical cavity of the right ear, and then we give it a margin for making the planning target volume. We give it a margin of 0.7 centimeter, and this is the planning target volume of the tumor, basal cell carcinoma of the right ear. So then we cropped it from the body, extending outside the body with 0.00 centimeter. So this is the uh, final plan for the basal cell carcinoma. Thank you so much.